This particular vaccine trial will engage 60,000 participants before the end of the year.
The depiction made by Health Chief Administrative Secretary Dr. Rashid Aman outlines efforts being undertaken by the national government to protect Kenyan lives. While still in its phase 1 trials in Kenya, the Chadox vaccine has been held to not only be efficient, but also distributable under normal supply chain conditions.
The meeting noted the increasing significance of a viable vaccine in the containment of the spread of COVID-19 and resolved that the committee should expand its mandate to cover matters related to efforts towards securing such a vaccine.
But even with the government as well as Kenyans making efforts, the COVID-19 severity continues to ravage the nation, evidenced by the rise in number of infections.
A lot of infections have been witnessed in places of worship, at weddings, as well as at funerals.
The Ministry of Health has attributed the rise in infections to the ignorance of protocols among Kenyans. According to the most recent pattern of COVID-19 infections, the country might soon cross the 100,000 infections mark, which further puts at risk more Kenyans, as over 80% continue to be asymptomatic.
I want to point out some key highlights.
Speaking on the looming doctor strike as well as the availability of PPEs, Aman cited that engagements are ongoing to avert the health crisis that may erupt from the strike occasioned by, among others, unavailability of protective gear.
Our medical experts are attributing in all of these counties to the flagrant abuse and flouting of the containment measures we have issued here at the Ministry of Health to combat this deadly virus.
With regards to the recent COVID-19 statistics, 551 individuals contracted the disease in the last 24 hours from a 4,675 test sample, bringing the nation's total tally to 84,169. An additional 266 people have recovered, adding up to 18,146. On the flip side, total fatalities have risen up to 1,474 after 5 individuals succumbed to the virus.
71 patients are in the intensive care unit, 36 of whom are on ventilatory support and 34 on supplemental oxygen.
Ben Kirira, K24, Evening Edition.